So what we have here, these are the afferent lymphatic vessels coming from the tissue spaces carrying the lymphatic fluid away. So these are various afferent lymphatic vessels. So what we've drawn there in green, these are these afferent lymphatic vessels. And they're carrying the lymphatic fluid away from the tissue spaces in this direction, towards the lymph nodes. Being carried towards the lymph nodes. And here we have a lymph node here. And several of these afferent lymphatics are going to be carrying material into a lymph node. And there we have a lymph node. And then the one or two lymphatic vessels, large lymphatic vessels that are carrying material away from the lymph node. These are exiting the lymph nodes. So these are efferent lymphatic vessels. So lymphatic fluid is taken to the lymph node via the afferent lymphatics and taken away via the exit or the efferent lymphatic vessels. And these lymph nodes are often described as bean-shaped structures. They're encapsulated, they have a capsule around the outside. The size varies quite a bit, from about 1 to about 25 millimeters. So a decent lymph node, when it's in a physiological situation, not in a disease situation, is about maybe 10 centimeters, 10-15 centimeters in diameter. And as we've said, there's a capsule round about it of dense connective tissue. So these are encapsulated structures, separate, anatomically succinct structures. These lymph nodes. And in the body, there's probably about 600 of these lymph nodes in different positions. Obviously a lot in the axilla, a lot in the groin. We're used to palpating to see if the lymph nodes are enlarged, of course. If the lymph nodes are enlarged, we call that a lymphadenopathy. And that can often be an indication of infection. Now there's infoldings of this dense capsule here into the lymph node itself, generating compartments within the lymph node. So there's compartments within the lymph node, and these are called trabeculae, infolds of the outer fibrous membrane into the lymph node itself, forming compartments. Now, the reason for the lymph node really is that in the lymph node there is a fine network of connective tissues, fine network of thin collagen strands, like a scaffolding of thin collagen strands between the trabeculae. So a fine network, a reticulum of collagen strands within the lymph node. And the key thing about this is this provides a habitat and a structure for the immune cells. And the main immune cell, of course, associated with the lymphatic system are the lymphocytes. So there's going to be B and T lymphocytes located throughout the lymph node. There's also going to be other immune cells, macrophages, so-called dendritic cells, which are actually a differentiated type of macrophage. So there's lots of immune cells here, and these immune cells can recognize if any bacteria come in. Remember, we could pick up some bacteria from time to time from an infection. If these bacteria go down through these lymphatics here, which are the afferent lymphatics, the afferent lymphatics will carry them into the lymph node. And in the lymph node is full of these immunological cells, so B and T lymphocytes. So the T lymphocytes are going to recognise the presence of the bacteria, or indeed viral particles, and they're going to stimulate the B cells to produce huge amounts of B cells called plasma cells, and the plasma cells produce the antibodies. And the antibodies, of course, will kill the bacteria. So this is an early warning system. So when the lymph is, the infection is still in the lymphatics, way before it's got to the blood, then the immune response can start off this specific immune response. And as well as that, there's other cells in here. So there's macrophages that will directly phagocytose any bacteria that are getting in. So this is an immunological gatehouse, if you like. It's an outer picket post for the immune system, detecting the presence of bacteria, destroying them directly, mounting an acquired immunological response with the generation of specific antibodies, even before the bacteria get anywhere near the blood, when they're still confined to the lymphatic system. And when there is bacteria in here, there can be inflammation in these lymph nodes, because the bacteria produce insulting chemicals that cause inflammation. And as well as that, the attack of the immune system is going to be an inflammatory based attack. So these are going to become inflamed, and they can also become swollen because of the great increase in the number of the white blood cells. The leukocytic response to the infection, as there's a proliferation of white cells to combat this infection. So the inflammation tends to make it painful. We get painful lymph nodes in infection, painful and tender to touch. And also we get swelling because of the increase in numbers of immunological cells, which causes the lymphadenopathy. But of course, this is exactly what we want. We want this immunological response. We want to find out what the infection is, mount a specific response, directly kill the viral and bacterial particles in the lymph node. So if you're a bacteria or a virus coming in here from the afferent lymphatics, this is a lion's den. You're probably going to get ripped apart, which of course from our perspective is absolutely wonderful, because what it means is that the drainage from the lymph node exiting in the efferent lymphatics, this fluid in here should be sterile. And many lymph nodes are going to generate a lot of efferent lymphatic vessels, and these are going to form progressively larger efferent lymphatic vessels. The larger ones are called trunks, and again the lymphatic fluid is channeled in this direction with valves which will open in this direction to let the fluid through, but then close to prevent it going back the way. And eventually this is going to drain into one of the two of the lymphatic ducts in the body, the right and the left lymphatic duct. And eventually these are going to drain the lymphatic fluid back into the venous circulatory system to go back to the heart. So anything draining from the tissues has to be filtered through the lymph nodes before it can get back to the blood, and this is the blood in here. So the blood should be kept sterile because this has already been through the lymphatic system before it gets back into the blood. But there is eventually a complete circulation there as the lymphatic fluid gets back into the bloodstream. Now I think I'll mention one more thing. From time to time, of course, unfortunately, some of these tissue cells become cancer cells. And one of the things about cancer cells is they lose their cell-to-cell adherence. So there's molecules on the surface of normal cells called adherents, and that kind of sticks them together. But cancer cells lose these adherents, so they tend to float away, and they're floating around here in the tissues. But they also get through these flappy capillary walls. So that means that cancer cells can also be drained away in the lymphatic system. They will also be drained to the lymph nodes. And we hope that the immune system can do something about the cancer, because if a cancer is immunologically recognised, of course it will be virtually instantly eradicated. So hopefully that happens most of the time. But if it doesn't, the cancer cells will grow in here when we can get lymphatic spread. So this is classic. So if we suspect a tumour in the breast, for example, of course we're going to palpate the axillary lymph nodes to see what they feel like. And typically, they're if there's cancer, they're enlarged and hardened, but normally not painful, because we're not getting the immunological inflammatory response. It's a pity, because if we were, the immune system would be eradicating the cancer cells. So we end up with this lymphatic spread, and of course eventually that can lead on to potential hematogenic spread. Now here I have, again from the physiology notes book, we just have another diagram just to give us a slightly different perspective on what we've just said about the importance of the lymph node. So we notice that these compartments are called sinuses. That's the tissue fluid is going in these afferent lymphatic vessels into the lymph node. We remember that there's lots of these collagen fibres throughout the very fine reticula. Reticulum is a network, isn't it? It goes back to the days of Roman gladiators. A reticula, the gladiators with a net. A reticulum, a network of these, and we also have the immune cells throughout here, performing their vital immunological functions, and hopefully, most occasions, sterilising the lymphatics the lymphatic fluid before it leaves via the efferent lymphatic vessel. Now what I've sketched out here is the crudest possible circulatory system. Let's just see what we mean by these diagrams. So this would be the arterial side of the heart here, taking blood into the arterial system through the capillaries and then draining to the venous side through the capillaries, venous blood draining, going back to the heart, to the venous side of the heart. So there we have a very crude circulatory system, and we know that we have tissues in the body. These are the capillaries taking blood to the tissue cells. So there we have our tissue cells, and throughout the tissue cells we have these networks of lymphatic capillaries. So here's our lymphatic capillaries. These networks of lymphatic capillaries, and these are draining the lymphatic fluid away in afferent lymphatics. Other afferent lymphatics are meeting up, forming a lymph node. There's inclusions in there, and then that's joining up, and of course the valves here are this way to make sure the flow is in the right direction, and these eventually, as we've said, are going to drain back into the circulatory system at these two specific points between the internal jugular and the subclavian vein on the right and the left side. So eventually two lymphatic ducts taking this lymphatic fluid back into the circulatory system. So we have a blood circulation, and we have this lymphatic circulation as well. So the lymphatic circulation in this way through these vital lymph nodes, taking the lymphatic fluid eventually to form a full circulatory system back into the blood system. And again, this diagram from the physiology notes book shows us a little more detail. So we have the blood from the left ventricle going onto the body here, giving up its oxygen to the, or some of its oxygen to the body, draining back this way by the inferior and superior vena cava to that side of the heart, blood going up to the lungs to be oxygenated, blood going through the lungs getting oxygenated, going back to the left side of the heart. But also we notice that the systemic lymphatic capillaries, which we've drawn here, are picking up lymphatic fluid from the body, draining them via afferent lymphatic vessels into the lymph nodes, and the efferent lymphatic vessels taking the drained, filtered lymphatic fluid back to the blood. And it's the same with the lungs. So there's pulmonary lymphatic capillaries as well. We certainly don't want excess tissue fluid in the lungs, do we? What do we call that if there's too much tissue fluid in the lungs? Of course, that's pulmonary edema, which will make you drown. The alveoli will fill up with fluid. We don't want that. So we need to be constantly draining the lymphatic fluid from the lungs. Again, that's going through pulmonary lymph nodes, because the chest infections are common. We need to be able to eradicate those. And again, once the lymph has been through the lymph nodes, it joins the efferent lymphatics, and we know that drains back into the circulatory system. So again, we have this complete, these complementary circulatory systems: the arterial system, the venous system, and the lymphatic systems, the systemic lymphatic system, but also the pulmonary lymphatic system.